Thank you, Madam Speaker. Madam Speaker, I rise to talk about this matter of public importance. And many people have shared stories with me and come to me with issues to do with maternity care, so I'm going to share some of them tonight. I do want to start though by acknowledging and thanking the incredible people who work in our health system, midwives, nurses, doctors, support staff, who show up every day and give their all, often in incredibly tough circumstances. I've been lucky enough to have 2 babies here in the Territory, one at Royal Darwin Hospital and one at home through the community midwifery program. I also had a partner who the midwife was maybe taking more care of than me because it was, you know, big things happening. But I still remember the names and faces of the midwives who looked after me. Their care, their calm, their kindness, I'll never forget it. And I know that many others carry these same memories because when maternity care is done right, it stays with you for life. We've heard a lot in this chamber tonight about the closure of and outside the chamber, about the closure of the private maternity ward. And in my mind, it's alarming replacement with a hotel. But what we haven't discussed much is the state of birthing services in RDH and the conditions people are forced to give birth in. The situation we have...
No idea.
I beg your pardon, Minister?
Sorry, no interjections.
Nobody's having babies in hotels.
No, but the private maternity, I'll just repeat, the private maternity ward has been replaced with a hotel. Not to have babies, but that's what happens for women after they come out of the hospital, if they choose it.
Thanks for the clarity.
The situation that we have arrived in is both caused by underfunding and chronic understaffing. Chronic understaffing is stopping the home birth team from operating outside 9 to 5 hours. Chronic understaffing is stopping the full use of the birthing suite at RDH. And chronic understaffing is stopping life-saving continuity of care. Sometimes women were telling me with tragic circumstances. Madam Speaker, RDH does not have to run understaffed. The government could fund the hospital appropriately tomorrow. The question is not about money, it's about priorities. If we have enough money to supersize our prisons to the tune of $500 million, then we have enough money to fund healthcare properly. If we have enough money to subsidise the anti-fossil fuel industry, then we have enough money to fund healthcare properly. The Chief Minister proudly said today that she thinks the government should stay out of people's lives and be there in the background, providing security so that if you need to call the police, they will come and help you. And if you need to call an ambulance, they will come and help you. And if you need to go to hospital, you will be looked after and you will be safe. Well, Madam Speaker, according to many of my constituents, that is not happening. Underfunding of maternity care is symptomatic of underfunding of all healthcare in the Northern Territory. And we know we can't have a healthy society if we do not have healthy people. Healthcare is a foundational right in our society. And if the government can't look after us when we need to go to the hospital because they've starved the hospitals of funding, then we need to think hard about the priorities that they are choosing for us. Madam Speaker, I want to take the time now to amplify the voices of a group of people who've been coming together to share their birth stories and are calling on the government to make critical changes to birthing services in Darwin and in the broader Northern Territory. And I want to in particular thank one of my constituents for bringing this group to my attention and to sharing their work with me. Madam Speaker, this group shared the following on October 7 in a media release. According to the Australian Institute of Health and Welfare, babies in the Northern Territory are dying at a rate more than twice the national neonatal loss average. At the same time, mothers at Royal Darwin Hospital are facing conditions that no woman in a capital city should expect. Labouring in hospital corridors, recovering from caesarean surgery without air conditioning, receiving ultrasounds on waiting room lounges, sharing bathrooms while in labour soiled with previous patients' blood, or waiting days for essential care because of staff shortages. They are losing babies because of a broken system that fails to provide continuity of care and describe not receiving basic dignity after loss. Grieving mothers whose babies have died are being placed to recover on postnatal wards alongside mothers with live newborns. Others describe devastating delays in diagnosis, limited bereavement services and follow-up due to fragmented care. We are tired of excuses. In 2025, giving birth in the Northern Territory has become a lottery, safe and supported if you're lucky, but too often traumatic and sometimes tragic. On Saturday, 4th October, around 100 women and men, including parents, birthing people, midwives, doctors and healthcare advocates, gathered in Darwin for a closed community forum to speak openly about their experiences of maternity care across public, private and home birth settings. The stories shared were raw and confronting, exposing failures across every stage of maternity care, from early pregnancy to labour to postnatal support. Some of these stories are distressing, but I'm reading them out from their media release. One person shared, "My baby died shortly after birth. I was placed in a postnatal ward surrounded by the cries of healthy babies. There are limited bereavement services." Another shared that, "I have had 8 pregnancies and 2 children. With my history of loss, I tried to access the midwifery group practice at 11 to 12 weeks for early support, but I was told I wasn't eligible. The early pregnancy clinic doesn't start until around 18 weeks, far too late for someone like me. I lost that pregnancy at 14 weeks. Women like me fall through the cracks before care even starts." Another shared, "I went to hospital 4 times with decreased fetal movements and was dismissed each time. At 37 weeks, my baby was stillborn. In my next pregnancy, I was given proper continuity of care and monitoring and my baby survived. Continuity is not a luxury, it's life or death." Another person shared, "I had my baby 6 weeks ago. It was an unplanned C-section. When I got to the room, there was no air conditioning or fan. They gave me a couple of wet towels to put on my neck and told me to point the air purifier at my face for a bit of relief. I stayed one night." Another, "She was born at Royal Darwin Hospital. They said she was healthy and we were sent home. Weeks later, I was told the wait to see a paediatrician was 1 year. By the time we got a diagnosis, spinal muscular atrophy, type 1, it was too late." A forum attendee shared this, "We used to offer choice, private obstetrics, home birth, midwifery group practice, a functioning birth centre. Now every option is being stripped away." Madam Speaker, the release from this forum went on to say, "Healthcare workers back these stories with clinical evidence, workforce shortages, insecure contracts and casualisation are driving skilled midwives and obstetricians out of the system. Meanwhile, critical infrastructure is underused, including the birth centre and Palmerston Hospital's maternity unit, both of which could relieve pressure immediately if properly activated." The release went on to say, "Political inaction has consequences. Despite repeated warnings, Minister for Health Steve Edgington has taken no meaningful action, relying instead on the line that he has requested federal funding. Meanwhile, services continue to deteriorate and families pay the price. Chief Minister Leah Finocchiaro must now intervene. This crisis is happening on her watch and the Territory's women, families and healthcare workers expect leadership, not silence. This is what Territory families are asking for. There are four key asks that reflect the 219 women-centred care strategic directions for Australian maternity services. 1. Choice in birth. Women should be able to choose the setting that is safest and right for them: hospital, midwifery-led care, home birth or private pathways. Continuity of care. Women deserve trusted caregivers before, during and after birth. This model reduces interventions, improves outcomes and saves lives. Staffing and support. Midwives and clinicians need secure, full-time roles, proper investment and incentives to stay in the Territory. Without this, safe care is impossible. And community voices in decision. Women, families and clinicians must have a formal seat at the decision-making table to ensure services meet real needs. Madam Speaker, this group of incredibly brave people sharing these personal stories and calling for change has sent invites to all members of this chamber to attend the next Birth Stories Forum on the 1st of November at 12 p.m. at 66 Smith Street. As the forum organisers say, these stories are not statistics, they are lived experiences of loss, trauma and resilience. It's time for our leaders to listen in person and act. For far too long, the NT Government, the Department of Health and RDH's executive team have failed to act. Palmerston Hospital sits underutilised, families are left to endure unsafe conditions and babies are dying at double the national rate. We are tired of excuses. In 2025, giving birth in the Northern Territory has become a lottery, safe and supported if you're lucky, but too often traumatic and sometimes tragic. Chief Minister Finocchiaro must show leadership where her Health Minister has failed. The Territory's maternity crisis is a test of her government's commitment to women, families and the future of the Northern Territory. Enough talk, the time for action is now. Madam Speaker, I share this media release from the forum so that everyone in this chamber can hear it, and I support their call on the government to uphold the 4 recommendations of the Women-Centred Care Strategic Directions for Australian Maternity Services made by this group. And I want to close with the words of one of the forum attendees, a senior clinician who said that yesterday's problem becomes today's emergencies because no one is responsible end to end. That costs lives. Madam Speaker, the time for excuses is over, the time for federal blame shifting is over, the time for bureaucratic inaction is over. Territory families are not asking for the impossible. They're asking for what the Chief Minister herself promised, that when they go to hospital, they will be looked after and they will be safe. And they're saying right now that is not true. And every day the government delays is another day that people are put at risk. I support their call to the Health and Chief Minister and all MLAs to attend the Birth Stories Forum in November. Listen to these families, look them in the eye and then come back to this chamber and tell us why $500 million for prison is a priority but ensuring safe births and proper maternity care is not. Thank you, Madam Speaker.
Member for Sanderson.